Good morning, good afternoon, or good evening to all of you joining us from all over the world. I'm thrilled to welcome you to the launch event for the first biennial International Maternal Newborn Health Conference, or IMNHC, which will be held May 8 to 11, 2023 in Cape Town, South Africa. My name is Anshu Banerjee, and I'm excited to serve as your co-moderator. The IMNHC is organized by Align MNH, a global initiative for which I'm proud to be serving on the steering committee as co-chair.
My name is Anita Gibson, and I'm the director of the Align MNH Secretariat led by Japaigo. Align MNH was founded in 2020 to facilitate the sharing of science, evidence, and programmatic experiences with the ultimate aim of contributing to accelerated progress in improving maternal and newborn health outcomes and preventing stillbirths, as we all work towards achieving the Sustainable Development Goals. The biannual conference series is a major aspect of Align MNH's work, and I work closely with Anshu as Align MNH is guided by an international steering committee of 20 global thought leaders and experts with direct practical experience in a number of countries around the world. I should also mention that Align MNH is possible thanks to the generous support of the Bill and Melinda Gates Foundation in collaboration with USAID.
During this global launch event focused on the conference, we will learn about the goals, objectives, conference theme, official conference tracks, ways to engage, and more on the road to IMNHC 2023.
We will be active on social media throughout the proceedings and welcome you to engage. Our IMNHC hashtags are #RoadTo2023 and #IMNHC2023. And our Align MNH handles are @AlignMNH. You will notice that we'll have simultaneous translation occurring from English to French. And if you wish to hear the sessions in French, please click on the link below the media player you're watching from now. If you have questions, also please note that the chat box immediately to the right of the video player and type any questions that you may have.
With that, it is now our pleasure to introduce to you our esteemed colleagues from Ethiopia and Mali. Dr. Leah Tedesse serves as the Minister of Health for the Federal Republic of Ethiopia, and Dr. Samba Sow is Director General within the Ministry of Health and Social Development. I'm proud to serve alongside both on the Align MNH Steering Committee. Over to you.
On behalf of our Align MNH Steering Committee, we would like to thank you all for joining this important session as we embark on our journey down the road to 2023. With less than 10 years remaining, urgent collective action is needed to meet the SDG-era targets on maternal and newborn health and the prevention of stillbirths. While many countries have taken meaningful steps, progress has plateaued amid competing health priorities, especially as countries transition through phases of the COVID-19 pandemic.
In order to reprioritize and advance maternal and newborn health, it is essential that we refocus and realign to protect the progress we have made. The first biannual International Maternal Newborn Health Conference will be held in 2023, and then every 2 years afterwards to maintain our global progress toward improving maternal and newborn health. For the first time in 8 years, more than 1,000 stakeholders from around the world will come together to accelerate solutions to improve maternal and newborn survival and prevent stillbirths in a coordinated and inclusive manner.
It is now our great privilege and honor to welcome our esteemed colleague from the government of South Africa. Thank you.
Warm greetings from South Africa. I am Dr. Manala Makua, the Chief Director, Women, Maternal and Reproductive Health, and I will be talking to you on behalf of our Honorable Minister, Dr. Matume Joseph Phahle, who is committed due to competing priorities. Let me start by thanking you, Dr. Tadese and Dr. Sow, for the warm welcome. And it is my honor to speak at this event when we embark on the road to the first biennial International Maternal Newborn Health Conference, which South Africa will be hosting very gladly in May 2023. This IMNHC conference will be following the successful conference that was held in 2013, where different stakeholders and countries committed to accelerate the agenda for maternal and newborn health. I remember in that very same year, we also hosted the Global Newborn Conference. We are aware that 2030 is imminent, and reaching the SDG goal requires accelerated efforts from different stakeholders. I therefore invite the 1,000 stakeholders across the world to work collectively to respond to the urgent need to improve maternal and newborn health, and importantly, to prevent the stillbirths. Let me join others in thanking the organizers and panelists of this important and successful event. Esteemed steering committee for IMNCH, the Melinda Gates Foundation, the USAID, among others, the WHO, and other supporting partners who convened this event, we really appreciate your efforts. As South Africa, we are still committed to maternal and newborn health. As a country, we continue to support the maternal, newborn, and child health activities. In 2019, we developed the new maternal, perinatal, and newborn health policy with related guidelines to reprioritize the women and children's agenda. This came when, as a country, we had reached a milestone of reducing maternal mortality to less than 100 per 100,000 live births, which we strive for over decades. But with the COVID pandemic hitting around the same time, as a country, we experienced the collateral damage of the pandemic on the maternal, newborn, and child health. We appreciate the series of collective events, this landmark event, the IMNCH, and many others to follow to build up to the conference. We would like to join experts across maternal and newborn health community and my fellow African ministers of health across the 27 countries, and to share their experiences and innovative ways in responding to the call to action. We are determined to be part of the assessing progress made by the individual countries, collective efforts such as the SADC, the AU commitments, and other collaboratives, and chart a path forward to improve and protect the health of mothers and newborns. These discussions have widespread impact as they help to inform programs and policies in South Africa and across the African continent. As a country, we join other African ministers in the pledge to improve funding, coordination, and accountability so that no mother would die unnecessarily during delivery and no child will die from avoidable causes of death. And of course, it is not just about meeting this global target. It's also about ensuring that expectant mothers and their newborns can access the highest standard of care and that they are met with respect and dignity as it is their right. Our new policy aims to improve the delivery of a range of maternal, perinatal, and neonatal health services that are comprehensive, equitably accessible, of high quality, integrated, accepted, and most importantly, respecting the mothers and babies, and they feel safe within the services. I am proud to say that this policy is grounded on the principles of universal health coverage, where as a country, we are very excited to implement and accelerate. It is also based on informed choice and consent to ensure that the care provided is equitable to individuals, couples, communities across South Africa. For nearly a year, this policy has guided academic curricula, research priorities, and stakeholders' agenda. Be it in the front line of healthcare workers or the practitioners or the staff working across the planning, the finance, and the human resource. to improve our service delivery platform, governance, and accountability for the provision of quality maternal and newborn health services. Today, despite the challenges brought forth by COVID-19, I remain confident that we are able to continue to deliver the service, which is very essential to the women and newborns of this country. No country is alone in its challenges. Together, we can drive progress for maternal and newborn health and survival, prevent stillbirths, and help set the stage for a decade of continued learning and collective action. This conference, IMNCH, the International Maternal and Newborn Health Conference, as it said, serves as our honor to focus on mother-baby diet and to drive collaborative among the maternal and newborn health community. Together, we will engage stakeholders like all of you who are tuning in today to plan the course correct and drive action, which is all powered by the data. We will work in partnership to address the remaining obstacles and gaps armed with the latest science and evidence. We will engage in dialogue, discussion, and even debate around the strategies and solutions to ensure effective coverage of evidence-based solutions to protect and promote the health of mothers and their newborns. The IMNCH will be our moment to learn from one another and to work together to drive collective action in pursuit to one goal, which is to ensure women and newborn not only to survive, but also thrive. In closing, I would like to invite you and hope that you will be joining South Africa for what will surely be another historic international maternal and newborn health conference hosted on African soil. On behalf of the government of South Africa, we are looking forward to having you there so together we can create a better future for mothers and newborns and reach our collective goal. I would like to thank you for your attention and thank you for the partnership.
Thank you, thank you, thank you. It is wonderful to hear the government of South Africa's commitment to host the International Maternal Newborn Health Conference. And I applaud their efforts on improving maternal and newborn health in their own country. My name is Queen Dube, and I'm co-chair of the Align MNH Steering Committee and currently serving with the Minister of Health in Malawi. Colleagues, partners, stakeholders, the road to 2023 is before us. Our vision for the International Maternal Newborn Health Conference is simple: take collective action in pursuit of one goal, to ensure mothers and newborns not only survive, but also thrive. To achieve the 2030 SDG era targets, together we will lead with evidence, share effective implementation strategies, review joint progress, and nurture collaboration and innovation within the maternal and newborn health community. That is our mission, and we'll do it together. Together, a coordinated and inclusive approach will serve to implement stronger evidence-based and respectful healthcare for both the mother and the baby, particularly in low-resource settings. We'll do this by nurturing collaborative relationships, sharing learning, and effective implementation experiences, and aligning our approach and metrics. Together, we will embrace a healthy and equitable future in which mothers and newborns not only survive, but thrive. To that end, I'm now pleased to share the theme for the first biannual IMNHC, the International Maternal Newborn Health Conference. And the theme is Together 2023. Our tagline is aligning together, accelerating together, saving lives together. During the first time in 8 years, more than 1,000 stakeholders from around the world will come together to accelerate solutions to improve maternal and newborn survival and prevent stillbirths in a coordinated and inclusive manner. our conference objectives, and the roadmap to how we will drive collective action for maternal newborn health on the road to 2023. Together, we will. And below our conference objectives, we have 5 conference objectives: enabling pathways to drive collaboration, coordination, cross-country learning, and alignment within the maternal and newborn health community. Secondly, to lead with evidence, share successes and effective implementation strategies, and identify promising solutions to improve maternal and newborn health and prevent stillbirths. Thirdly, we want to review and recognize country, regional, and global progress towards MNH targets and milestones. Fourthly, prioritize action to accelerate progress towards meeting the 2030 Sustainable Development Goals. And finally, build a dynamic community, including engaging the next generation of leaders. Today, we also officially launch a new conference website, www.imnhc2023.org, where you will be able to access essential information to help inform your planning for and participation in the IMNHC. You will find direct links to the Align MNH Knowledge Hub, which will continue to be our knowledge sharing platform for curated content. I encourage you to explore it further, sign up to receive future updates. And the unveiling continues. We have a number of committees helping shape the IMNHC, and I will now welcome an update from the program committee, who will share with us the official conference tracks, information on how to submit abstracts, and much more.
My name is Dr. Tlaleng Mofokeng. On behalf of my fellow co-chair, Dr. Miki Chopra, and all of our program committee members, I am thrilled to provide an update from the IMNHC program committee. The 2023 IMNHC provides an excellent opportunity for knowledge sharing. The conference program will include oral and poster presentations on a wide range of topics related to emerging science, effective implementation strategies, and proven best practices for national leaders, policymakers, technical leaders, and program managers in maternal and newborn health. The tracks chosen were designed intentionally to have overlapping components and themes, and descriptions are not exhaustive. Across all conference tracks, the 2023 IMNHC aims to highlight efforts that demonstrate successful collaboration across different types of stakeholders, address equity gaps in newborn care and outcomes, and have identified successful ways to reduce newborn and maternal morbidity and mortality and stillbirths. We are now pleased to share with you the 7 official tracks of the conference. Global guidance and local adaptations. New global initiatives and guidelines that aim to reduce preventable maternal and newborn morbidity and mortality and stillbirths. Local initiatives to adopt or operationalize global guidance. Local and global initiatives related to knowledge translation and dissemination. Strengthening quality of care. Strategies to improve quality of MNH care, provision and experience of MNH care, including respectful maternal and newborn care. Interventions to address barriers to implementing safe and respectful care. Integrated care for the mother-baby dyad. Demand-side interventions to improve access and equity. Targets and matrix. Efforts to create and implement targets and metrics to improve MNH outcomes. Strategies to improve data quality, enable better data use, and address barriers to local use of key MNH metrics. Health systems and workforce. Reorganizing MNH care and services. Interventions to improve financing of MNH care. Pragmatic interventions to increase the MNH workforce, including nurses, midwives, physicians, and others. capacity building strategies in pre-service and in-service settings, prevention and clinical management, research evidence on efficacy and safety of new prevention, diagnostic and clinical management interventions in MNH care, ethical inclusion of pregnant and breastfeeding populations in clinical research, innovative tools and strategies, ready-to-scale product and service delivery innovations, potential strategies for assessment and prioritization of innovations as they are piloted, scaled, and sustained, programs that build knowledge, capacity, and confidence to leverage innovation to accelerate impact on MNH, humanitarian and fragile settings, MNH care in fragile and crisis-affected settings and among affected populations, including refugees, asylum seekers, internally displaced persons, and those residing in areas impacted by armed conflict, natural disasters, extreme food insecurity, and complex emergencies. Abstracts and pre-formed panels may be submitted starting in July 2022. Submissions to the 2023 IMNHC will undergo a peer review process by an international review committee. The highest scoring abstracts and panels will be chosen for oral presentation in a conference session. For key dates regarding abstract dispositions and presenter confirmation deadlines, please review the conference calendar. We will also be soliciting a call for additional abstract reviewers, so please be sure to connect with us if you are willing and able to contribute in this way. Do visit imnhc2023.org, our conference website, to gain access to this information and more. On behalf of the IMNHC Program Committee, we look forward to your active engagement in our abstract-driven tracks as part of our conference agenda, and thank you for your time.
I'm pleased to serve as the co-chair of the International Maternal Newborn Health Conferences Communications and Technical Advocacy Committee, along with you, Mary.
Likewise, Aparajita. I know we are very excited about launching this conference committee and the important work ahead for us to do to support the goals and objectives of the conference. The IMNHC Communications and Technical Advocacy Committee brings together the global maternal and newborn health community of communicators and advocates to include in-country networks, civil society organizations, maternal and newborn focal points, and other partners working in the communications and technical advocacy space to advance the goals and objectives of the conference. Membership of this committee is open, so if you're interested in participating, please visit the conference website at imnhc2023.org to learn more.
In addition to our robust scientific abstract-driven conference agenda, we will offer multiple sessions that are non-abstract driven. Types of offering for these sessions may include a technical marketplace, satellite sessions, and more. Additional information will be shared in the coming months on content submissions for these session types, and we will be encouraging feedback from members of this committee. We also offer a variety of sponsorship opportunities. If you are interested in becoming a sponsor, an exhibitor of the conference, or if you prefer a tailored package to suit your budget and marketing objectives, please visit the conference webpage for more information. We encourage you to download our sponsorship package. There are multiple ways in which you can be engaged as a partner in the conference.
We hope you will be able to join the IMNHC Communications and Technical Advocacy Committee. Visit the conference website at imnhc2023.org to learn more and to access our partner engagement social media toolkit to help us spread the word throughout the community.
And now we are back to bring you some final updates on the road to IMNHC 2023. We are pleased to announce that the first ever joint progress report for Every Newborn Action Plan, or ENAP, and Ending Preventable Maternal Mortality, or EPMM, will be launched at the IMNHC. The collective efforts of ENAP and EPMM, globally, regionally, and at the country level, align with and support the goals and objectives of the IMNHC. The discussions at IMNHC will also contribute to informing presentation and review of the progress report during the World Health Assembly in 2023. And it's important to note that the IMNHC 2023 will primarily be planned as an in-person convening. There will be select opportunities to participate virtually that will be made available. These details will be shared soon.
We also want to share with you that we're dedicated to providing a conference experience that promotes diversity, equity, and inclusion. We want to be quite intentional with our planning to ensure we maximize opportunities for meaningful engagement of all participants. Included in this approach is the establishment of a country engagement committee, which will work in close collaboration with a number of partners and initiatives currently engaged with multiple countries on issues related to maternal and newborn health, such as EPMM, ENAP, the Quality of Care Network, and the Global Financing Facility. Stay tuned for more on these efforts. Also, there will be scholarship opportunities available on an application basis. The IMNHC planning team will be updating this page with information on how to apply for a scholarship, so be sure to check back on this. Also, please know that the health and safety of all attendees and colleagues are a top priority of the IMNHC and our planning team. We will continue to monitor the situation closely and provide updates as needed. We do hope to safely convene in person in Cape Town in May of 2023.
This concludes our program for today. Thank you for joining us, and please do visit imnhc2023.org for access to all IMNHC information and sign up to receive future updates. We look forward to engaging with you over the course of the next year. Let our countdown on the road to 2023 begin now. Thank you.